A very good morning to all of you, and welcome to the presentation on disaster and aging. We are assembled here this morning to launch the report on Disaster Risk and Age Index. My name is Godfred Paul, and my colleague here, Claudia Byrne, we both work with HelpAge International. The statement I would like to make this morning is, the world is changing and the world is aging. What do I mean by this? Currently, there are 868 million people above the age of 60 living in this world. By 2050, that number will go to 2.2 billion. So we are going to see a very large increase in the numbers of older people. 80% of those by 2050 will live in the developing countries. And what do we mean by older people and disasters? The best people who can tell you is an older person herself. And we have this morning with us Lena from the Association of Older Persons in Ormoc City in the Philippines. Lena, can I invite you to share your experience? Please come. Please come.
Good morning. I am Lina from the Philippines. I am one of the survivors of that super typhoon Yolanda, a Haiyan, we call it Haiyan here, that hit the Philippines last November 8, 2013. It was so strong, very strong, that it did not lift for 3 hours without having all our roofings, our wallings blown down to the ground. My children and I take cover in the most safest place we thought, the bathroom. Then after that, we take courage. I told my children that despite what happened as an older, we have to stand back again in whatever difficulties there might be. Thank you.
Thank you very much, Lena, for sharing your experience with us. Like Lena mentioned about the Philippines, we have figures from Japan, where we assembled for this conference, in the place where 23% of the population is 65 years and over. 56% of those who died in the tsunami were 65 years and over. Very high numbers. Similarly, in the US, during Hurricane Katrina, in a population where only 16% are 60 years and over, those who died were 75% above the age of 60. Very disproportionate and very high numbers of older people. And why is that happening? Because the current systems are ill-equipped. They do not take into consideration the issues of older persons. Disaster management systems do not include older people. And the other main thing is policymakers and practitioners do not consider the capacity and resourcefulness of older people and include them in the programs. We all know about the vulnerabilities of older people, and there are many, like poverty, neglect, health problems. And there is some focus on this. But a lot of the times, the practitioners and policymakers do not consider the resourcefulness and the capacities of older people, like the historical knowledge, their respected figures in the community, and the life course experience. And this is what we would like to promote and include to make the DRR program stronger. Like I said, we are launching the disaster index, and my colleague Claudia will share about the index.
Okay, thank you, Gadi. I'd like to just share the index with you. Today is our official launch of the Disaster Risk and Age Index. This index hopes to demonstrate with existing data, using data that's already out there, the situation of older people globally. it ranks countries against each other to determine where is safe for older people in the context of disaster. We also hope it will be a very useful tool for policymakers to support them to include older people in national policies and practices. But more importantly, we want to highlight the major trends and the context of older people in an aging world. This index also highlights there are gaps in the existing data. So we're looking very much at national level. But even at national level, it's difficult to get disaggregated data. And at local level, that's even more problematic. So we want this index to call for more disaggregated monitoring systems. I'd like to just introduce a methodology behind the index. It's actually quite similar to a HVCA that you would undertake at local level to identify disaster risk. We've got a hazard and exposure component, which takes into account both natural hazards and conflict using indicators. The second component is a vulnerability component. So this includes development and deprivation data, looking at socioeconomic data, and specifies different vulnerable group data. And finally, there's also a capacity dimension. So this dimension measures lack of coping capacity. In this, we're looking at governance, communication, infrastructure. And for each of these components, we've got a range of specific indicators used to calculate the components. Just to mention that this is based on Inform 2015, which is a global open source index developed by the European Commission. And Tom from the European Commission is actually here with us today. What HelpAge have done is we've taken some of the specific indicators that Inform have used and targeted them more specifically towards older people. So for example, we've removed child mortality in the general index, and we've replaced that with pension coverage. And also, we've used other disaggregated data that's available to specially focus on older people for this index. Here are some of the results of the index. So the previous slide, you can see the hazard exposure map. This map shows the different countries which actually are more affected by disaster. The second map looks at vulnerability and age. So again, the darker colors are more affected in terms of vulnerability. And the third is a map showing coping capacity. So in the index report, you can find those maps. If we go on to the next slide, this shows the actual results of that mapping. This is the aggregated results of the mapping to show where in the world are older people more at risk of disaster. And again, these dark red countries highlight those. Somalia has come out as #1 on the list here. And actually, Malta and Finland are deemed the safest countries for older people. So here is a list of the top 10 countries, and you can see the different components are reflected. The first column is the overall findings of the index, but the next 3 columns show the disaggregated information on hazard, vulnerability, and capacity. You can see again the top 10 countries. If you refer to the index, it includes a list of the overall 190 countries, breaking it down into these components. And here is a country example just to show how the index can be visualized. This is the Central African Republic. And we can see the different dimensions of hazard, vulnerability, and coping capacity reflected here. This actually has quite a high overall risk. And we also wanted to take an example just to highlight the gaps in the index of a country actually who's come out quite strong in the index. This is the United States. And you can see from the diagram, compared to the previous one, we've actually got quite low incidences of hazard. It's average to low. Vulnerability, coping capacity, and overall risk come out quite low in the index, which means it's a relatively strong performance. This is due to very good pension coverage, high life expectancy in the States, and quite good performance on Hyogo. However, we can also see in reality older people are actually quite vulnerable in certain parts of the States, as evidenced by Hurricane Katrina, where 75% of people who died were older people, in spite of quite a low proportion of the population. So this highlights that actually at national level, the index might mask vulnerabilities at local level. We need more sensitive monitoring data. We need to have more locally based monitoring systems which disaggregates that data.
The report also makes some recommendations, and I would like to present 3 key recommendations here. The first one is action must be taken to support the Hugo framework, and hopefully the framework that will be announced tomorrow morning will have inclusion of older people in all areas. And what we mean is they should be part of the decision making, they should be partners in the implementation process, and more importantly, they should be included in the monitoring of the programs at the community level. And point 2, we have a 14-point charter which we are urging the governments to sign up that makes inclusion of older people very strong and strengthens the DRR, national DRR programs. This is a copy of the 14-point charter that we have been distributing, and I would like to urge everyone here if you're in the national delegation or if you're members of CSOs, to impress upon your national delegation to sign up to the Charter 14 to improve your DRR programs. And the last one is that the policies should be age and climate smart. And what we mean by this is more investment on pension schemes, better healthcare systems, age-friendly physical environment, communities that are age-friendly, just like the child-friendly spaces. And like Laura was mentioning, important to gather data, sex and age disaggregated data, so that proper activities and programs can be developed for them. We come to the end of the presentation, but before we finish, I would like to invite another member of the Older Persons Associations, Annie, from OMOC in the Philippines, to just give us her final words on inclusion of older people.
Good morning, everybody. I'm Annie from the Philippines. I am also one of the survivors of the Typhoon Yolanda. We were also affected of that, but we don't lose hope. I encourage all the elderly and the young ones to always have hope in their heart. And most of all, we thank God for saving us such a miss. That's why I'm begging you to please include the elderly and all of one and everybody in all your programs. Thank you.
And
Thank you very
just,
much.
Annie, can I ask you, before you sit down, we'd like Annie to officially launch our index. So Annie, could you please open the ribbon for us? Just a symbolic opening of the ribbon. Thank you. And there are copies available of the index in the HelpAge stall in this room, but also our colleagues are handing out a copy if you would like a copy.
Thank you very much, Annie. We have time for a couple of quick questions.
Yes, I'm from Pakistan, and fortunately we were partnering with HelpAge in one of the province of KP, Khyber Pakhtunkhwa, and we have worked with them with the flood-affected people. So I have there one observation, because HelpAge have started its good work and the aging started, and it was mainly the mainstreaming started, and after 18 months at once the HelpAge have phased out their work there. So this is because when the people started, and we have done their 200 cataract surgeries, and we have established 28 OPAs there. And those 28 OPAs are regularly sending us their requests for mobility aids or for cataract surgeries or for eye care, but there is no one who can take care of them. So, and we are ready for our volunteer support, because we are there. So this is just a comment. Otherwise, we really appreciated the work done HelpAge in Pakistan. Thank you.
Thank you very much. We have time for one more question or comment, if there is anyone.
Can I just maybe briefly respond to that? Thank you for your input, and also just to say that we are also calling for the governments to sign up to Charter 14, which also includes distribution of age-friendly evacuation, material mobility equipment. So please urge your government also to provide these services. Thank you.
Thank you, and thank you very much to everyone. Thank you.